So I have patients who are very ill. There's a degree to what you need to do. It depends on what you're trying to fix. Some people need to be very restrictive. Some people, I'll say, if my patient comes to me and everything is fixed and their kids are visiting and they want to go have an ice cream, I don't recommend dairy. But once in a while, you can, if you're healthy, we evolved to eat a little bit of crap if we ran out of meat. So it depends on how healthy we are, that 90% of the time we're eating just this great food. If we are able to get it, a little bit of the time we might eat some crap. It shouldn't hurt us. I have 3 kids, but one of them is a teacher in Athens, and I send him a crockpot so he can get cheaper cuts of meat. He can't be eating ribeye. So actually, the first edition of Good Fat is Good for Women Menopause had a lot of snacks, butter on cheese, butter on cheese, butter on cheese. And then a couple of years ago, I read a book called The Devil in Milk by an Australian who was explaining A2 milk versus A1 milk. There is absolutely an issue with dairy because of the casomorphins content. 2 tablespoons of A1 cow milk is equal to a shot of heroin in an opiate sense, right? So the inflammation that a casomorphin can give your body, 2 tablespoons of milk is equal to a shot of heroin. I mean, he literally writes this. So there are different, the whiter the milk, the fresher the milk, what you have is a lot of, or dairy, kefir, yogurt, whatever, goat cheese, you have a lot of protein. If you have aged cheese, the fermentation process eats the protein and the lactose. The lactose isn't really an issue. It's more the proteins. The proteins are inflammatory. So if you're not well, if you have an autoimmune condition, your immune system is overreactive. It's going to see a protein like gluten or dairy or casomorphin. It's going to see that as a pathogen. It will react. How does it react? Again, it could be any way, but it will react to that protein thinking it's a virus. So if you're, as you said, depending upon where you are on your health journey, if you still have pain, you still have arthritis, you still have eczema, you still have psoriasis, I would take out dairy. And in some cases, I'll even say to try to stop butter for a week or so. And I've had a couple of people have a really good result from that. And then they heal, and then they can add in the butter. So you can take a bunch of heavy cream and whip it like crazy. And the liquid that is separated from the fat is buttermilk. Most of the protein is in that liquid. There's a tiny bit of protein left in the butter. And if we make ghee, we can understand if you put a bunch of sticks of butter in a pan and you heat it up, the lactose and the protein rise to the top and you skim it off. And it's literally like, tiny bit. So it's the dose of the poison, I guess. Most people, that little tiny bit of protein, milk protein, doesn't bother them. Pasteurized, the whole raw thing that has no effect on the protein content. The only thing that's an issue with dairy is the protein content. If you have pain, it should be something that you take out in order to try to heal. The whole point of the elimination diet is you can take out all this stuff. I've talked to so many people who say, I took out this and this and this. I feel so much better. My back pain went away, but I still have no libido or, something else. So maybe they have to work on, remove something else, or there's some other imbalance going on. I remove everything. And then the egg yolk is the first thing I add. A lot of people react to the egg white, not so much the yolk. And the egg white is just protein. There's no nutritional value to it. It's the egg yolk has all the nutrients.